Now, you or someone close to you might have an addiction. It could be a substance addiction involving drugs, alcohol, party pills, or a behavioral addiction. We've got the internet, sex, gambling, eating disorders, even shoplifting. Would you know how to deal with it? Would you encourage this person to come forward to seek help? Or perhaps you would hesitate because you're afraid of what people might think of you. Now, many still believe that addictions are a moral wrong or something that only the weak-willed suffer from. In fact, it's quite the contrary, and it is recognized as a disease. Now, We Care Community Services Limited, a charitable organization, is launching a new platform known as Transformation in Humanity to raise funds for addiction recovery and to destigmatize addictions in Singapore. And as you just heard in the news, the National Addictions Management Service, or NAMS, is also stepping up efforts to reach out to families of gambling addicts. So this is certainly becoming more and more of an issue in Singapore society. To find out more about awareness, acceptance and prevention methods that can help manage addictions for sufferers and their families, I'm joined by Associate Professor Dr. Munidasa Winslow. He's a psychiatrist in private practice. Also joined by We Care Program Director Prem Kumar Shanmugam. Thanks for joining me this morning, guys.
Thank you.
Thank you. Morning.
Now, first of all, let's talk about the sorts of addictions we're seeing in Singapore. What is the most pervasive form of addiction? Perhaps I could go to you for this, Professor Winslow.
I think the most prevalent addictions are the ones which are still to the legal drugs, to smoking and to alcohol. And if you go, those are the substance addictions which are most prevalent. If we look at those which are most prevalent among the behavior addictions, then I guess we are talking about gambling and unfortunately, we don't have the numbers for sex and cyber addiction, so we just have to make guesses there. But it's still gambling as number one, I believe.
You know, it's funny, you mentioned smoking, and that's something, you know, we've sort of come to accept in Singapore, even though, you know, we're often chiding smokers for smoking in all the wrong places. You know, we see smokers everywhere, and, you know, it's something that no one really frowns upon too drastically. You know, we look at it as social behavior that might be unacceptable, but not an addiction that the person needs help with. However, there are so many other forms of addiction that can be really debilitating in the short term as well, not just in the long term like smoking is. So, in your opinion, are we really more vulnerable to addictions at this time in our development? Prem, perhaps you could come in here.
I think people are becoming more aware of addictions because of, talks and workshops and trainings. And it's not that the numbers are increasing, just that people are becoming more aware and they're coming up to seek help.
That's good news though, right?
Yeah.
Do we have the means to help them?
I think we're a lot further along the path than we used to be 5-10 years ago. For one, there's been a lot more training of therapists, counselors, a lot more courses on how to help somebody with an addiction. Both in the public sector as well as in the VWOs, the welfare organizations. And so there's a lot more understanding of what can be done, how to do it, use of individual, group and family therapy methods to help someone. By the way, you mentioned an interesting point earlier on. You were saying that people don't see smoking as an addiction. I think they are wrong there. People do see smoking as an addiction.
They do see it as an addiction.
But it's a legal addiction.
Legal addiction, that's what I meant. Yeah, yeah.
But alcohol is a legal addiction too.
It's not as troubling, you know, as say alcoholism might be, in the sense that alcoholism could totally ruin the way you work on a daily basis. You know what I mean? It could disrupt your day-to-day living.
I think people right now with smoking also find their lives pretty much disrupted. They got to
they should.
They got to find yellow boxes to go and smoking.
Well, they should. Yeah, they should. And that's the kind of messages that we are driving home at this point.
Yes.
You were saying that there have been a lot of improvements in the care and treatment of addictions as well. However, clearly more still needs to be done. Otherwise, you wouldn't be running this program to help destigmatize addictions. Let's talk about those stigmas. In your experience, Prem, how bad can it get for an individual with an addiction?
Well, one of the reasons why people actually find it difficult to come for treatment is because of the stigma. You know, if I'm an addict or if I'm an alcoholic, how am I going to get a job? Even if I do get a job, do I acknowledge that? Do I say that? And when I say that, what happens to my job? At We Care, we run lots of anonymous groups. and they're very particular about anonymity. Yeah, so I think destigmatization is very important in treatment.
What about the families of addicts? What sort of stigma do they inflict on the person with an addiction, in your experience, when it has happened?
Well, we believe that when we treat the addict, we need to treat the family as well. Now, the recovering addict goes back home to his family members, and if the family members are not treated to accept this, what happens is that he finds it difficult in recovery. Yeah.
How exactly does this make the process of recovery harder? Also for the healthcare professional who's trying to reach out to the addict. Professor Winslow?
I think, again, it just goes back to the stigma. I mean, when I first started in addictions as well, there was a fair amount of stigma that the people thought that I was crazy to be wanting to treat alcoholics or drug addicts. I think things have got a little bit better. Now they think only I'm maybe half crazy.
Why do you think they even think you're crazy for wanting to help another person?
I think the stigma is there that, again, we've been taught for many years that drug addictions are moral problems, and we don't see that the person who is struggling with a drug addiction as much as with alcohol or with smoking is actually trying their best. Most of the time they're trying to get out of it. They just do not have the tools, do not have the ability to get together their lives, or they don't even know the process of what a recovery looks like. And
what does a recovery look like?
I think we have to realize that addictions are not acute problems. It's not like treating pneumonia. You give an antibiotic and the next week they're better. But treating addictions are very much like treating chronic medical illnesses like asthma or asthma or hypertension or diabetes. And believe it or not, the relapse rates and the compliance rates with treatment for all these illnesses, including addictions, are about the same. So you got to take it that this is a journey. You got to teach the person. I mean, how many diabetics, first time they're told that they're diabetic, stop eating cake or stop really control their diets. So it is a process of changing behavior, changing lifestyle, changing thinking, and putting those things into practice.
All right, we'll continue talking about what else we can do to help with addiction recovery and to destigmatize addictions in Singapore so that more will come forward to seek help and get treatment. Stay with us on 938 Live. 938